have an exceptional programme ahead and are pleased to welcome speakers from across the UK. This seminar brings together a range of expert speakers that will be exploring steps local authorities have taken and are continue to carry out in developing and supporting a diverse workforce at all levels, coordinating better dialogue, promoting equality, engaging and responding to the needs of the diverse communities we serve, as well as meeting and addressing challenges, particularly post-COVID-19, on issues like employment, skills, and a sense of being part of local places.
When we look at the socioeconomic determinants of COVID-19, so looking at infections and mortality, some great work here by Dr. Philippa Sarr, and she looked at the issues of larger households and the issues of self-reported health. So people not coming forward in terms of healthcare issues, and those reliant on public transport. And again, much higher levels of COVID-19 infections per 100,000 people in those proportions of the population. And what Dr. Sarr found was mortality, household size, use of public transport are perhaps less important, but there is a clear relationship between age and ethnicity and self-reported health. But equally, areas with older populations with a larger share of Black and Asian populations will see significantly worse levels of self-reported health and therefore more COVID-19 deaths per 100,000.
What we've also done is the Achievers Award, talking about skills and education. So from 2006 to 2015, we had austerity. The community, with the council, with the police, with the fire service, have put on an Achievers Award, but we also did work termly with officers to close the educational attainment gap. These are the sort of things that are really important. And again, a mindset. I remember the meetings, the education officers saying, no, we can't achieve 78% of Blacks children achieving 5 GCSE. Yeah, we know your children, and the community saying, hang on, but they're our children. We bring them into the world. We should know them better. But by the end of that journey, we exceeded. The target was 77 and we achieved 78. And it was lovely at the Achievers Award, we did a yearly Achievers Award, where you saw the young people of African heritage and mix attending, fully dressed, looking beautiful with their families. That changed the perception of what others had of the Black community.
And so I was determined that before Bristol makes any headway around what we were going to do around memorialization, then we needed to have those conversations and get everybody in the room. And so we're doing that through the Legacy Steering Group, and we've now kind of reconstituted our terms of reference to sit alongside the History Commission. So we will be informed by the work that the History Commission is doing, and we are basically the doers. We're the operational arm. We will actually secure the funding and identify and work with organisations across the city to come up with ideas and projects that will solidify the community's response and needs for how they want to atone for the sins of the past in this city.
At Commercial Services, equal opportunities is very important to us. We work very closely with our local authority partners to ensure that we're delivering the needs and requirements to their community. I am currently working with a local authority at the moment on some senior executive search pieces, and something that they have said to me when taking the brief was it's very important that we are reaching out to people from all backgrounds, not just women, not just men. You know, they wanted to receive a short list of candidates from a diverse background, which was really welcoming to hear that, you know, people are putting this in their recruitment campaigns. So we also work with education people. They've been supporting students and adult job seekers for a number of years on internships, apprenticeships, and then back into paid employment.
My name is Rich Stanley, and I'm from Matsula. I've been asked to share some important messages with you about what we can all do to help protect our friends and family and stop the spread of coronavirus in Stamford Hill. The main symptoms of coronavirus are a high temperature, a new continuous cough, a loss of change to a sense of smell or taste. Most people with coronavirus have at least one of these symptoms.
We gave them sample posters. This one has scientific facts. We've got the social norming stuff. You know, loads of people have had this done. You should have it done. We had the risk factor that said, you know, people like you are at risk, you know, you should get the vaccine. And then we had the kind of emotive stuff, you know, hug your family again, get back to normal. And then the last poster we showed was the very factual, it's free, it's easy, this is how you get it. The last poster was by far and away the most popular amongst all the groups we tested it on. We showed various different versions of it as well, and they really liked the version, although they did say the lady should be wearing a mask properly, which of course she should. So what does this mean for communications? Well, this shows us that people want to be informed rather than persuaded. People don't want to be manipulated. They want to know how is it approved so quickly? How does it work? How do I get it? There's a strong preference for facts so that people can make decisions themselves, much less interest in the why, as in protecting myself, save the NHS. So the trusted messengers need to adopt information-based messaging, the importance of key facts, correcting misinformation, and again, using those medical professionals. So,
but the starting point for us was, you know, we can't fix Birmingham's problems unless we face up to our own challenges as an organisation. And we know that there are inequities within the City Council and within our practice as an employer. But what this shows is that there's no kind of single magic bullet here. Every theme is crucial and interlocking. If you pull out one of those things or don't do one of those things, it makes the whole approach much weaker. And without that firm foundation of data to build upon, we won't be delivering for every employee because we won't be understanding their needs. We also have public accountability. So there will be regular updates on this going to our public cabinet meeting. And in addition, there's regular engagement within the organisation with our staff diversity networks and our trade union colleagues. So we're ensuring that this is visible, it's accountable, and it is subject to that robust challenge at every point.
Youth work needs to me to be a role model in someone else's life if they don't have that. So the people who come from bad backgrounds with father or mother not being there, then they can have that role model from a youth worker. And finally, youth work for me means developing your own skills within yourself, leadership and more. So learning to be a leader and helping others to become leaders. And, yeah.
Wow, and this is Roberto, one of our young people in the Manchester community. And again, this is what we do. We try and provide those spaces where people like Roberto can come to and where they can express their thoughts and views, and we'll look at what we can do to support and further him. Roberto couldn't have done this, 6 months ago, so it's that work in the background that's helped to improve those confidence. And again, it's listening to people like Roberto. I can sit here and talk to you about what's going on as a youth worker, but sometimes we need to listen to the young people's voice, their feedback, for them to tell us as well, what it is that they want for us to implement that change and provide those life chance opportunities.
On behalf of the staff and members of APSE, we hope that you've had an enjoyable morning and early afternoon and that you have an enjoyable day. Thank you all for your participation, and let's connect now and pass on the learning. Take care all. Bye.
Thank you. Bye-bye.